Hello everyone. Welcome to this week's episode of Weekly Dose with Dr. Uday. I have a treat for you. I have Dr. Malathi here with us. We're going to be talking all about mind and body treatments in wellness. So I'm very excited to have her here with us. So I'm going to start with introductions. For those that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I am based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine, and I provide aesthetic services to my clients as well. And with both modalities, my goal is to have my patients not only feeling good, but looking good. So I'm actually going to turn it over to Dr. Malathi. She's going to tell us, introduce herself, and then we're going to get right into the topic. So I'm going to turn it over to you.
Thank you, Dr. Uday. I'm excited to be here with you today. I love how you said that you want your clients to feel healthy as well as feel good about how they look. So it's a whole person, right? So you're actually addressing what is integrative medicine. So my name is Dr. Malvi, um, and I'm an integrative medicine expert. So I help people with chronic illnesses take back control of their lives and give them the hope that they can lead a full and satisfying life despite the challenges that they're facing with their health. I also help healthy people, I empower them with the knowledge and tools they need to remain healthy and age with vitality.
Absolutely. That is beautiful. All right. So Doc, how did you get into what you do now?
So, I'm an internal medicine doctor. So I finished my residency in internal medicine. I'm board certified in internal medicine. I started off my career as a hospitalist, and the first 9 years, I worked in the hospital taking care of really acutely sick patients.
Mm,
Then I reached a stage of my life where I couldn't, do the night shifts. And I'm being very honest here because as doctors, we never recognize what an impact what we do has on health. So at that point, I realized that, doing night shifts is not sustainable. So I transitioned into becoming a primary care doctor.
wow.
So in the clinic, the time that I became a primary care doctor, I had a panel of people who were predominantly younger people, and they wouldn't like to take medications, and they would keep asking me, doctor, what can we do naturally? We don't like to take even ibuprofen, but what can we do naturally to help with our symptoms? How can we change our diet, and what else can we do to remain healthy? We want natural. And I kept here initially, I was like, I was a hospitalist, right? So nothing is natural inside the hospital. It's all medications and this and that. So I then I kept listening to the same thing. Then I said, so many people are asking the same thing. There must be something. And at that point, I started looking for, and I came across this fellowship program at the Andrew Weil Center for Integrative Medicine. It's a fellowship in integrative medicine. It was an online fellowship for a very robust 1,000-hour program. I was very interested and I joined the fellowship.
Mhm.
That was the best decision of my life, actually. Not joining med school, not doing residency. This was the best decision
Okay.
because this is where I found a lot of answers to those questions that my patients were asking me, my clients were asking me. They were correct. They were
Mhm.
right in asking those questions because I learned in this fellowship that there's a lot they can do to help their body heal. So that's how I ended up with integrative medicine. I was practicing the traditional system. I was by the time I finished this fellowship, I knew in my mind, this is the philosophy of medicine that I want to practice. So I have started my own practice. It's called Ayur Integrative Medicine, and here I am.
That is so awesome. It's well needed work. So when you have a client that comes to you, looking for help, how do you start that process of, figuring out what they need and then, helping them?
It all starts with their health goals. We an integrative physician addresses the whole person. We don't address the disease. A disease or a condition is only part of a person. So integrative medicine focuses on addressing the whole person, not just the physical, but also the mental, emotional, and the spiritual well-being of the person. So the starting point to all is finding out the goals. Hey, what are you hoping for? What are your goals with respect to your health? What do you want? Where do you want to go? What do you want to achieve? It all starts with that. And integrative medicine brings together treatments from traditional Western medicine, and those treatments are vital and life saving. So certainly we don't set them aside. They're part of the tools that we use. So traditional Western medicine and blends them with relevant medical and health practices or treatments from other systems. They could be ancient systems like Ayurveda, traditional Chinese medicine, or homeopathy or naturopathy, or they could be other complementary systems like manual treatments, massage therapy, chiropractic, all of those. So we bring it together in an evidence informed way, and we make I make a plan that is personalized for that person based on the health goals that they want to achieve. That's how the journey starts. Journey starts with sitting and figuring out with the client. I'm a partner. I'm a guide in this journey for them towards their health goals.
That's amazing. So, what tips can you, what actionable tips can you give somebody that they can start today that is looking to improve their wellness, just in general, from your perspective?
The most important thing is I'm going to talk about most important things, and I'm going to focus on the mind body treatments.
Sure, sure, yeah.
If I have to give one tip before that, what we
Yeah.
eat is very important.
Yes. Yes.
Okay. So that is one thing that we cannot forget. What we eat is absolutely important, and it is the foundations of our health actually lie in the daily choices that we make. Simple choices like, what am I going to eat today? Am I going to eat my salad today or not? Am I going to, go for that walk that I've been postponing?
Absolutely. Yeah.
Am I going to do those 5 minutes of meditation that I've always been thinking of, but not ever getting to do that?
Mm.
What time do I go to sleep? So these little choices, the foundations of our health lie there. So choose wisely.
Absolutely. Absolutely. That just, it's just, you hit the nail on the head, because I always tell my patients those big results that you're looking for, they're hidden in all the little things you do every day. So that is exactly it. So thank you so much for that. Now, I usually ask, um, our guest docs why they do what they do. And I think we kind of started with that. So I'm going to give the follow up question, which is, with all the experiences that you've had and all the life that you've lived so far, if you got a chance to meet your 20-year-old self, what would you advise them? What would you say to them if you could? And it's a loaded question, obviously.
It is a loaded question. If I would give one advice to my 20-year-old, that would have been for that 20-year-old to keep her mind open to the fact that health, wellness, treatment is just not from a Western system of medicine. I wish I had more open mind and I had imbibed more around me with that open mind. So when the mind is open and I'm receptive, that we tend to imbibe or learn or absorb a lot of things around us. That is the one thing I would tell the 20-year-old. I do believe that my life journey was meant to be as it was. Um, I was a hospitalist for 9 years. I was a primary care doctor. Those are very different perspectives in anyone's journey of health and illness. Um, you know, I had a different view at each stage of my career, professional career, and I feel that all that knowledge helps me to become a better integrative physician. you know There are some times where I would think, I wish I had done this fellowship earlier, but no, I
Mhm.
wouldn't have gotten so much wisdom from that fellowship. Just not knowledge. I would have gotten that knowledge even then, but I wouldn't have gotten the wisdom from this fellowship that I got now, because I
Yeah.
have these different perspectives and now I can put them together well.
I totally agree with that. Like the big thing is just like you see an iceberg and you see the pretty stuff on top, but it's all the things that are underneath that lead you to. So it's basically all your experiences make you who you are today, and
Yes.
that really is it. So yes, 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 I love it. I always ask that question because there's somebody out there that could help. Um, and then the final question, which we talked about earlier, is where, if people want to connect with you, look you up, that kind of stuff, where would you want them to go?
I my website, my practice is called Ayur Integrative Medicine, and you can find me at www.ayur.today, and I'm going to spell that. It's AYUR dot today. Ayur is a Sanskrit word for life. It means life.
That's nice. That is so nice. Thank you so much, Doc, for being with us today. So, you guys, you heard it. Definitely look up Dr. Malathi to check out all the help that she can give you with wellness. On the flip side, if you're looking for a family medicine physician, we are available to see patients, and we would love you to give us a call. Our number is 304-350-1087. Or you can also look up us up online at www.applevalleyfamilymed.com. So you guys have a wonderful week. Thanks for joining us. All right. Bye.